So today's tutorial of the day is going to be the cross section of the ankle. Now this is just a diagrammatic scheme to help you learn the 5 nerves that supply the ankle. So we're just going to concentrate on this circular part here and not actually draw the foot, because that makes it more complicated. So you start by drawing a circle. Now I always think of this picture as a person wearing headphones, because that just really helps me remember which image it is. So most images I have get a little like memory in my head. So that's like the headphones, and this is like your little face. So this is your talus bone, this is your calcaneal tendon, this is your medial malleolus, and this is your lateral malleolus bone. And then across there is the extensor retinaculum. So first of all, we're going to start just above the medial malleolus, and we're going to add a green dot, which is your saphenous nerve. And we're going to add a blue dot, which is your great saphenous vein. So quite useful for cannulating in sick patients or in neurosurgery when you need veins in the foot or the leg. So very useful to know in emergencies. So next bit, we're going to go above the extensor retinaculum. So add in a few green dots, and these represent the superficial fibular nerves. Now the word fibula can be also interchanged with perineal, but we're using fibula throughout this book. So beneath the extensor retinaculum, we put a red dot, and this represents your dorsalis pedis pulse, which you can find in your foot. And then next to them, you have your dorsalis pedis veins. And then just on the lateral side, you have another nerve, which is your deep fibular nerve, also known as your deep perineal nerve. So for me, I remember this as DP, DP, DP. So they're all the DPs sit under the extensor retinaculum. So next step, we'll move round the circle. So between the lateral malleolus and the calcaneum tendon, we draw in a green nerve. So this is your sural nerve. And then another little blue dot, and this time it's your small saphenous vein. And then the final section will be here, between the calcaneal tendon and the medial malleolus. And this time we're going to draw another artery, and this is your posterior tibial artery. Some little veins, posterior tibial vein. And then another nerve, and this is your tibial nerve. Not your posterior tibial nerve, that's just often written, you'll find it online, but that's the incorrect terminology. It is the tibial nerve. So there you go, you have your 5 main nerves that supply your ankle, so that'll answer lots of different questions. Saphenous nerve, your superficial fibular nerve, your deep fibular nerve, your sural nerve, and your tibial nerve. Hope that helps.